If a bone marrow biopsy shows fat, then you're dealing with a lot of aplastic anemia. This is the case of bone marrow failure. There's no red blood cells, no white cells, no platelets. It's just fat. It's just anemia, bleeding, and infection risk. So despite the high EPO, the retic count is going to stay low. Why? Because the bone marrow can't respond. And so the cells that are made up are morphologically normal, so the MCV is still going to be normal in range. But in aplastic anemia, it's like the whole bone marrow factory is just shut down. Pancytopenia, fatty stuff, retic count is going to be low because the bone marrow can't respond. And there's no hemolysis, so there's normal haptoglobin, and there's also no schistocytes, but it's a pretty dire circumstance. So here's our question. 32-year-old woman has fatigue, easy bruising, and frequent infections. The lab shows hemoglobin 7.1 and the platelets at 18,000. Leukocytes 1,400. Retic count is low. That's very important. EPO is still high. Bone marrow biopsy shows hypocellularity and increased adipocytes, which of the following is most likely present. So it's going to be our normal mean corpuscular volume, because even though the stem cells are wiped out, you don't make enough cells, but the ones that you do make are still like normal in size, and that's why the MCV is normal. Kind of weird, but it's true. Lower EPO, that's not going to be the case because the kidneys are trying to help out. So the EPO is actually going to be high because the kidneys are like, I'll help you out, brother. But they can't. So they're just doing the best they can. Increase retic count. Nope. The retic will stay low. Why? Because the bone marrow is dead. It can't respond. Haptoglobin, that's seen in hemolysis, but there's no hemolysis here. And so nope, you just can't produce. It's not like you're breaking it down. There's no schistocytes. There's no hemolysis. So that's the reason why it's not C. Increased mean volume, no, that's like your folate or B12. So yeah, that's the answer, normal mean. If you like science facts, you like learning stuff like this every single day, like and subscribe. New content all the time.